Subcommittee hearing on House Bill 383, New Hampshire Vaccine Registry.
Clerk may or may not be showing up here, just, he's in pockets, I understand right now. And what we have in our subcommittee is Rep. Emerson, Sherman, Fothergill, and Madam Weber, am I right there? So we all have the amendment in front of us. What I'm going to start off with, if I may, is we already had this hearing on February 3rd. An amendment that was supposed to show up within a week did not for 3 weeks, and that's why we did not have a subcommittee till right now. We're now under a time crunch, as it were, but the option to retain is still on the table for the record. Although we don't want that to happen, but it is still there should there be a question of concern that comes up today. There's a good representative. Here he is. So that being said, I was going to first ask nows for Representative Kirk, who is aware of the evolution of the bill from the original to his amendment to now a new amendment that he's worked together with Rep. Sherman on. If you would give an overview, Rep. Kirk, on the evolution here and where we are.
Tom and I had a discussion last night, and thank him for keeping me in the loop. His bill is identical to the one that was worked out between Health and Human Services and me, with one exception, that we've eliminated...
This one, the phrase.
Thank you. We've eliminated the phrase on page 3, line 14, that starts after the comma in registry, and it says, and we are eliminating this, and no healthcare provider shall discriminate. Let me put on my glasses so I can read. So, thank you, Mary.
Are you reading from Rep. Sherman's amendment, or yours?
No, I'm reading from Rep. Kirk's amendment.
Rep. Kirk, okay.
This is the language. The only difference between the Kirk amendment and the Sherman amendment is the elimination of this language. And Representative Sherman will correct me if I'm wrong. We're eliminating the words on line 14, 15, and 16 that say, and no healthcare provider shall discriminate in any way or refuse medical care to a person because that person declines one or more immunizations, vaccinations. The argument that Representative Sherman put up that I accepted, at least temporarily, is the fact that this is not directly related to the vaccine registry. Representative Sherman is going to be checking with the Medical Society and others to see whether or not this language could be reinserted in the Senate or whether it needs to stay out. But for right now, I've agreed with him that this can be removed. The other issue that is not in here that both he and I want to address is whether there is a way to simplify the administrative burden on physicians and physicians' offices without adversely protecting the opt-out that is part of this bill. If we can do that, it's great for everybody. But we don't have the time to do it now, and Representative Sherman agrees the bill should go forward to the Senate, but we will be working in the interim with many others to try to deal with that issue. Nobody wants to create additional administrative burdens if we can figure out a way to avoid them. So I'm fully in support of the Sherman amendment.
And just to clarify, Rep. Kirk, on the subject matter you just spoke of, that's on page 1, section 2. In that description of the bureaucratic requirement, is that what the focus would be on that you...
Yes.
Concern on?
Right.
The rest of the bill is not up for contention in the discussion.
No, it's just how can we make sure under, this is on the Sherman amendment, page 1, line 8, that section of what has to be done and how an option is given to people and what the physician has to do. Can we ease, if there is an excessive administrative burden on the physicians, can it be eased? And that requires study.
Other than that, there was no, just...
At this point, you're correct.
Conjecture or concern. Okay. All right, Rep. Sherman, do you have anything?
Yeah, I was just going to add, under that section, I have a commitment from Dr. Lamb, from the department, from Representative Kirk, and any other interested parties to work on section 2 between now and when the bill gets to the Senate to see if there's wording that would decrease the administrative burden. The commitment that we also have is that we understand the goal of making sure that people are aware every time they get vaccinated that they have an ability and a right to opt out of the registry. That's clear. The question is how to make that work practically in physicians' offices. And hopefully Representative Fothergill will also join us. Because we currently have a huge administrative burden put on us through the development of accountable care organizations and the process of meaningful use, which is the terminology that's used by the federal government on documentation required for both licensure and reimbursement. And it's a massive increase in data gathering, and generally probably to the benefit of patients and certainly to the benefit of understanding outcomes. But it is a huge issue, and so with the agreement that we will work on this and possibly be introducing an amendment in the Senate that would address Section 2. The only change between the Kirk Amendment and the Sherman Amendment is the what was felt, first of all, to be completely unrelated or mostly unrelated to the registry is how people who choose not to be vaccinated are treated by providers. But there is also, and Dr. Lamb will speak to this, there is also already language on the issue of discrimination for people who choose not to be vaccinated. And there are also rules in general for how physicians treat patients, and Representative Kirk and I were talking about this on the issues of abandonment and the issues that we have guidelines that we have to follow when we decide for clinical reasons or for behavioral reasons not to continue to take care of a certain patient. So the major reason for pulling that out of this bill is that it's not related to this bill. But it does bring up an interesting question that we actually faced. I was thinking about this last night. We faced in the early days of the AIDS crisis when physicians refused to treat AIDS patients because of the fear that was accompanying those patients. This is well-documented risk that comes along with non-vaccination, but it is also in statute that people can choose not to vaccinate for religious reasons. So I think it's something that is certainly worth further discussion and looking into what are the rights of patients who decide not to be vaccinated, but that's not what this bill is about. And
Okay, we'll focus now on what the bill is about.
right.
Rep. Kirk, a question for you now. Recognize Rep. Emerson. Change from the initial bill was opt-in, and now it's an opt-out.
The original bill as introduced had an opt-in for adults
Yes,
and an opt-out for children.
Right.
The bill as it now is before you has an opt-out for both children and adults.
Okay, and your reasoning for that change?
Compromise. Look,
Wait a minute. Who are you compromising with?
I was compromising with the department, which has as its overarching goal, everybody in the entire state needs to be in the and this is my language, they will dispute it, but this is my perception. Everybody in the state needs to be in the registry. Public health is so important that we have to override, let's call it individual privacy rights. As a practical matter, if you have an opt-in, very few people participate. We're all inertia driven. It's too much of an effort. If you have an opt-out, most people will do nothing and therefore not opt out, and therefore they will be in. So in the interest of trying to compile a registry that's reasonably useful, if there are very few people in the registry, it's not as useful as if there are many people in the registry. This was the compromise we came to. So I understand the consequences. Some people might like it, some people might not. But I think the registry is a good idea. I think it's important to have this information for public health, provided there are limitations for those people who, for whatever reason, don't want to be in a state database. And that's the compromise.
Okay.
They would prefer a totally different picture, but this was the consensus agreement, and I think it's a fair one for the state. Obviously, there are some people who disagree.
Yeah, we'll address that in a moment, but Representative Emerson.
Thank you, Mr. Chairman. One thing that I'm concerned about is a baby getting out of the neonatal ICU after months and months and months and going to the pediatrician, and the baby is too young and too fragile to be vaccinated, and here is a child in the pediatrician's office that has not been vaccinated and gives this baby measles or chicken pox or something. And I was just wondering if we could work on something that, in that type of a case, it would have, like on Mondays, everybody that's not vaccinated come in for their, checkup. But I am concerned about that.
I think it's really critical that this morning, in the limited time we have, that we focus on the registry and not on the pros and cons of vaccination or the risks of non-vaccination. That's not the issue here. The issue, and I don't mean to shut you down,
Okay.
but I think that's a really,
No, I'll do that.
okay. This whole issue of to vaccinate or not vaccinate is critical, and it's made even more critical by the Florida outbreak. But that's not the issue this morning. The issue this morning is really all about the registry and how to make it a fair registry that is meaningful. And so that's.
Does that make sense?
It does.
Yeah, when you bring up the head.
But I would like at some point address that.
Okay, Representative Fallio.
I just had a quick question, probably for Health and Human Services. Thank you
Please
for
do.
allowing me to do that. It says that the
Where in the
Line.
bill are you
What
reading?
line?
Identify
reading.
line and page.
the
Sherman Amendment?
Sherman Amendment,
First page,
first page,
line.
and it doesn't matter. I forget where I read it, but it says that any information as determined by the commissioner is going to be provided. So my question is going to be name, rank and serial number?
That's line 31 on page 1.
Is it going to include lot number of the vaccine and such like that? Is that something that would be considered?
Yes, hello, my name is Marcella Bobinski, and I'm from Division of Public Health Services. And yes, there are a number of elements that go in, and it will be some demographic information, so we can actually identify and make sure that the child is going to the same information is going to the vaccine history on that same child. And there will be the vaccine name, the lot number, the expiration date. So if there ever is a problem with a lot number, we can go back and take care of that child.
Just a follow up, Madam, on that. Under current, I would say 141, is that already exist, or is that new? The issue of, as Representative Fallio was pointed out, as determined by the Commission.
Yes, that was getting written into rules.
Into rules, but does it exist now under 141?
Yes,
Okay.
I believe it does, again.
Just trying to confirm that. I apologize, I don't have a copy of that, the existing immunization registry issue in front of us.
Representative McMahon,
Yes.
the existing statute does have a provision regarding rulemaking by the commissioner that does allow the commissioner to specify what kind of information would be collected that would be consistent.
The reason, subcommittee, the reason I was bringing that up is that after reading this and just multiple times was, is it a dog or a cat here? And I'm saying that what exists now and what's the true change outside of, as Rep. Kirk pointed out, opt-in versus opt-out, and taking the line out that Rep. Sherman is recommending in his amendment. What's the substantive change here on what already exists for the registry?
Paragraph 2
And it's
is also.
paragraph 2, that's why I was asking if, on that discussion point, if the subcommittee was in agreement with that, and that do we let the tender mercies of the Senate address it, or do we address that here?
I think we should do it.
Paragraph 2.
I think it's going to take significant work to sit down with providers
Right.
and Representative Kirk and any other interested parties to get the exact language that satisfies everyone. So I would recommend that we go ahead with the current language and present to the Senate a new amendment that would change that language.
Yeah, I broached that subject, and like guidance from the subcommittee here, and then we can open up some comments as well. Historically, I have not seen that work well.
Right.
And I broach it because with what you bring to the table, the heavy hitters we have here are guys in the business, and ladies as well. But there's a timeline that even the Senate's even faster in terms of doing this work. So my concern is there a concern shared by the subcommittee that we should do that here before it goes, or if not, that it's with open eyes, we know it may not happen the way that you argue. There's different influences that take place at the Senate level. Representative?
I can speak to the procedure with the Senate, because I have a certain amount of experience with that, although not with the Health and Human Services Committee. I agree that there's a real concern about when we let it go, will it get done between here and the Senate? But I'm also very much concerned that we are under a deadline now. We do not have 3 weeks to have everybody come in and work this. It sounds to me very much like what we have in front of us, although not perfect, is good and is a reasonable compromise as a starting place. And my personal feeling is I would prefer for this to come out, ought to pass and be sent to the Senate with the hope that we can do a little more tweaking. But if that doesn't happen, understanding that if that doesn't happen, I am more comfortable having this in place than I am waiting for the perfect, because I think in this case the perfect is going to be the enemy of the good. I think that people have had really good discussions which, although nobody is completely satisfied, has at least addressed the need of people for more information, the need to get the registry going, and the need to preserve the individual concerns of individuals who don't want to be in the registry, which is the real big clump in that. And I would hope we can get further, but if we don't get further, I think it's more important to pass this on than it is to wait until it is perfect.
Okay, I appreciate that. That's why I wanted to get the ideas, and now, before I recognize, the point
And
is
that's just my personal
no, that's,
thinking on
no,
it.
it matters. And the issue here was, it's not going for perfect, I'm going for great. Good, that's for somebody else. And so,
And Chairman, I mean, I actually have important information that relates to this, so I could, and if Representative Farther
Okay,
would
go ahead.
refer to. As you're probably aware, in the Senate, we actually brought, unbeknownst to us, Representative Kirk was also very conscientious of making sure that we proceeded with getting legislation, because all parties recognized through the rulemaking process that there was a need to improve the language of the immunization registry, language that had been around for over a decade, and that it was a concerted effort working together. We had worked with Senator Molly Kelly, file a bill, Senate Bill 130. I have been in constant communication with the chair of that committee, your counterpart, Senator Sanborn and Senator Kelly. They are clearly understanding the progress that you folks are making here, and they understand that in essence, this is their Senate Bill 130 for all practical purposes. And I just wanted to bring that to your attention so that in some ways, because I totally understand people's concerns about getting the bill right coming out of the House, because you can't be assured what's going to happen in the Senate. But as I hold this chestnut collectively in my hand, I represent to you, we will give as an agency working along with all the other very important stakeholders sitting in this room to make sure that there's a concerted effort that the issues around the burden on administration to the providers and any other issues that might come up will be well discussed in the same way over the 5.5-hour period over 3 separate meetings that Representative Kirk was gracious enough to entertain the department amongst the 4 attorneys and Marcella Bobinski to try to get you the best work product possible here today. So it is really with great pride that work product, and I think that I have to add to that commentary the abundant amount of time in the last 2 days that this subcommittee has been working on this, and particularly Representative Tom Sherman and Janet Monahan from the Medical Society. I have to give them a shout out that a lot of energy and effort has been done to make sure that while we're meeting here today, you have something in front of you that you can be proud of as a starting point for further discussions between now, but prior to the initial hearing date in the Senate. So with that, Reverend Mann, thank you for your courtesy allowing me to provide that information.
thank you, sir. Before I recognize Rep. Kirk, do you agree that this is plans or takes the place of Senate Bill 130?
Yes.
Okay. Rep. Fowler.
Thank you. So I was just going to add that in my opinion, I think this is a good bill. Section 2 might need some work, but if it's out there for a year and practices tell us how it's working, how it's not working, we can certainly adjust it after that time. Because most importantly, if after a year or two we find out that 30% of people are opting out, then I would say the bill isn't doing what we want to do, and we need to be a little stronger with the language, because I think Representative Kirk had said at one point that he expects it to be less than 5%, and I think that's quite reasonable. But if it does end up to be 30, 40% opting out, then I think we need to either drop the registry or make it a little bit more useful.
Or 0% on the other side. If nobody's opting out, that would
That would be great.
be a concern. I mean, it would be great, but it would also be, maybe they're not getting the message that they
There will
have
be
that
at least
right.
one person who opts out.
Yeah, when you go by different names, Bob Smith.
Probably already has measles.
That's because he's in the witness protection program.
Not any longer. But in all seriousness on this, that we had everyone coming here, is there any commentary relative to, we just, outside of that one sentence removal, the amendment is not unknown, as Rep. Kirk, this was brought to the table, it's now about a week that's been out. Is there any further commentary? Sir?
Everett Lamb, pediatrician practicing with Exeter Pediatrics, where we care for over 15,000 kids. I also am a member of the Medical Society's Executive Council, and wear a couple of different hats, including a member of the New Hampshire Immunization Advisories Committee that works with the department in formulating vaccine policy.
Oh, and Doctor, if I may, what's the difference between immunization and vaccination? 5 seconds.
The act of administering versus the idea of protecting.
See, I knew there was a definition, Dr. Sherman.
I told you yesterday.
Yeah, no, you had two different words for it.
You can be immune without being vaccinated.
The reason I broached it, and at the risk of not trying to be funny here, but when the existing law would have just called it the immunization registry, and now it's / vaccination. What does that tell us citizens in the state of New Hampshire? What's the difference between the two?
Well, I think if you use measles as an example, there are people in the population who have never been vaccinated against measles, but they are immune because they were born before 1967, and it's presumed that they would have contracted the illness and gained protection from it. Those people who are still with us are lucky that they did well from getting the illness, but not everybody has been actively vaccinated.
Okay. And how would we, just very quickly, because I want to hear what you have to say on the other question, but how would we know someone is immune if they don't come to the doctor and say, be a part of this registry now with a vaccination?
It's well accepted based upon age at this time,
Oh, it's
particularly for
Because you're old.
measles. For measles. Based on-
I call it aggressively mature, but
You were born after 67.
yes. No. But that is it though?
Well,
Yeah,
for that particular illness, for other illnesses, not necessarily.
So what I'm just curious if, for citizens out there, myself included, am I in a registry de facto by age alone? No. So you still have to go to your doctor and whether it's by age, I guess, if you don't have the vaccination, then that's how you would go on record, by opting in, as Rep. Kirk has proposed.
Or not opting out.
Or, I mean, correct, right, either way.
Yes.
All right, Representative Fothergill, then I'll...
Just a quick comment. As a civil surgeon, I do examinations for immigrations. And so a lot of times children will come in and I don't know where they sit. So I'll actually run tests to see if they have been immunized. And so the immunization status may be positive. So I document they have antibodies to measles. So I know they were vaccinated at some point in the past. But I can't document that. I can document that they've been immunized, and that would be, I could call it into the state, so it would be in their record, they would be in the registry as having been immunized to that process.
Okay, Dr. Lamb, complete what you were going to say earlier.
Just to follow up with what the representative said, the other piece is they may have been exposed to the disease, they may not have been vaccinated against it, and that may, the testing may help to distinguish that. But my statements, if I could just briefly make a statement, which I think may encompass some of the conversation we have here. I do believe that New Hampshire's time for an immunization information system, it is now. And I have testified previously that every other state in the country has an existing functioning system, but I also understand that time is of the essence here for us as we move forward. So I do greatly appreciate Representative Kirk's reconsideration of the initial bill and the extensive work that he and the department put into it to make the vaccine registry what I think is going to be reality shortly. And then I appreciate Representative Sherman and Janet Monahan and the other folks again who came back this week to really fine-tune things. But I do believe that Representative Kirk, he delicately balances individual rights with the larger public health needs that we have. And then I do think that we're now one giant step closer to an opt-out registry, which follows the original intent of the 1998 RSA, which was enacted and that of vaccine registries in general. The amendments remove the obstacles, as Representative Kirk very eloquently said, that would require all adult patients to opt in to the registry upon receipt of each vaccine offered. This bill now permits the creation of an entirely opt-out statewide registry, as it was and is still intended to be. I also appreciate the sensitivity surrounding the nationwide general vaccination discussion by not allowing the passion of those few who oppose vaccines and immunizations altogether to cloud the judgment of this particular issue, because this is not about vaccines itself, this is about the registry. And so this particular bill has nothing to do with the actual administration of vaccines, and certainly does not force anyone to receive vaccines against their will. This is about a highly efficient record-keeping, cost containment strategy and advancing good public health. The registry, as currently proposed, respects the rights of those who do not wish to participate. We've come up with that, and again, it's very well said. And thank you for understanding that this bill is not meant to politicize immunizations, which are arguably one of the greatest public health achievements of all time. But as a state, we don't need any further impediments to implementing an operational registry. As a representative of the medical community, I would be remiss if I didn't point out the changes that were made in the fine print in Section 11, and I thank you very much for doing that, particularly the ones who refer to no health care provider shall refuse medical care to a person because that person declines one or more immunizations or vaccines. Well, as far as I'm concerned, and I think the medical community is concerned, there is no room for discrimination in medicine, period, okay? And in fact, this is the current law. As recently as this past Tuesday morning, this particular, the larger committee discussed a different bill and sounded that licensing boards are typically tasked with governing medical practice. And so on behalf of the medical community, I thank you for refraining from overreaching into medical scope of practice by dictating who physicians can and can't see. That's a discussion, I think, for another day. And even the American Medical Association's Code of Ethics in Section 9.06 states that physicians have the ability to make these kinds of choices for their practices. Now, as the measles outbreak continues to make headlines, pediatricians like me hear daily from overwhelming numbers of parents who favor vaccination, and I think this speaks to your concern, Representative. They worry about unvaccinated children sharing waiting rooms with their own children who are either too young or too sick to be immunized, putting their children at unnecessary risk of exposure to devastating communicable diseases. By placing knee-jerk restrictions on physicians that may have profound, unanticipated, and unintended consequences. But this can be a very slippery slope. And please understand, and this is where I agree wholeheartedly with Representative Sherman, that paragraph 11's last phrase has absolutely no bearing on the establishment of an effective vaccine registry. So having said that, the medical community is wholeheartedly in support and favor of NH, which is New Hampshire's fledgling state-of-the-art opt-out immunization registry. And I ask for your strong support in advancing the amended version of this House bill today, because this is our time for an operational registry, and I appreciate everybody's time.
Thank you, Dr. Ms. Sun?
Good morning. My name is Laura Condon. I'm a resident of Bedford, and I'm a volunteer advocate with the National Vaccine Information Center. And I also sit on the board of directors of the New Hampshire Vaccine Association. I do not speak here today for either one of these entities. I come to you as a private citizen. And I have been involved in this issue for quite some time, in particular the vaccine registry for a couple of years now. I've worked with Representative Kirk, I've worked with folks at the department on this. I'm quite familiar with this. I would ask that this committee reject both amendments here and pass the original bill that Representative Kirk presented. I do believe that is the fair compromise. And if I may make a particular points here, with regard to the doctors rejecting parents, in fact, as an advocate, parents reach out to me, doctors reach out to me as well. and so do nurses. But I did just get contact 2 days ago from a parent who said she received a certified letter from her doctor kicking her and her children out of that medical practice. This is a New Hampshire parent. So they are, in fact, today being kicked out of their medical practices because the parents choose either not to vaccinate, or what you will find is many parents experience a severe vaccine reaction in their children, and although they did vaccinate, they are then making the very careful medical decision to protect their child from further vaccines and further harm. And in fact, I dealt yesterday with this little child here, and this is her vaccine reaction from her Pediatrix vaccine. She also has severe diarrhea and she's critically ill as we speak. And I'm not so sure what decisions her parents will make going forward with regard to vaccines. And certainly these are parents that are making very difficult decisions, dealing with difficult medical conditions, and should not be further harassed by reminders, phone calls by a government entity to submit their children to further vaccination. The opt-in is a very easy procedure. The patient is there, gets vaccinated, the doctor says, do you want to be in the registry? He says yes, they check and they sign. Very, very easy to do an opt-in for children and adults. Representative Kirk called for an opt-out for children, was not a position I agreed with. I thought they should have the same rights as adults, but I thought it was a compromise. The opt-out, which is now what Representative Kirk is asking for, is very difficult and very cumbersome. And we've seen this problem in other states. What that would require is that would require me, if I've received vaccines, to make contact with every provider who might have provided me with a vaccine to make sure they don't put me in the vaccine registry.
Hold that. Is that true?
Then if I have been to, then I'd like to ask a question, that if I have been to a family physician and been vaccinated, if I was in the emergency room and gotten vaccinated, if I was some sort of clinic and got vaccinated, how will, because as the bill is written, I would sign an opt-out and it would be retained at my doctor's office. How is, or perhaps I also went to a pharmacist too. How is my record prevented from all those sources?
Representative Sherman.
I will pass this along to the department, but there is a mechanism, actually we're going to use that mechanism in another process where everything that is currently in the registry, if they opt out, say this child who has had an adverse reaction, the family decides for whatever reason that all the prior documentation that's in the registry, they want to opt out and they don't want anything in the registry. The department will expunge that record, including the request, and that's in this amendment, including the request to opt out. So every bit of information, every single identifier for that patient is expunged. Physicians, on the other hand, are required to keep the record for a number of years. That's statute. And so the record will stay in the physician's office. We are not allowed to get rid of that. Representative Fothergill, I think, will second that.
You second that? Okay.
So we can't expunge the medical record, but the registry, and I'll defer to the department, will be expunged completely. So she does not have to call all the prior doctors and ask them to opt out for her. The opt-out is a single motion, and that's covered in this amendment.
Representative, if I may respond to that and follow.
Not yet. What do you have to add to that so we can have a complete answer?
Representative McMahon, Mary Castelli, Department of Health and Services.
Welcome, madam.
Thank you. The answer to the point that has been raised is the way this bill is structured, the opportunity to opt out is exercised either when you're being administered a vaccination or by your current healthcare provider. The current healthcare provider may provide information in the current healthcare provider's medical records. As to former medical providers, that is exercised differently, and a former medical healthcare provider will only provide information at the request of a patient. So there's a specific act that has to happen as to former. As to the current, that's where the opt-out occurs. So you don't have to reach out to your former providers.
Okay, that answers that. Is there any other from the subcommittee? Does that make sense? I mean, not make sense. You understand that?
Okay, what's your other?
With all due respect, Representative Sherman was referring to somebody who's already in the registry and how they get out, and I understand that mechanism. My concern was, I don't wish to be in this registry. And how do I prevent my records from being dumped into this registry? It's my concern.
It's right, Laura, it's right here. Line 21, page 1. At the request of a former patient, you have to ask if you want it in. Okay? So unless, with the exception of your current medical provider, whether you're actually getting the vaccine, you're just there for an office visit, he has to give you the opportunity to opt out. Okay? But if you want any information from a prior provider to get in, you have to, in effect, opt in. You've got to go to the guy and say, please send my records to the registry.
So that my doctor needs to contact me and ask me if I'm going to...
No, nothing will happen unless you take action with respect to former.
Representative Webb.
Current.
Because the point is that no doctor that I have been to in the past is spending time rummaging through my records to send my old information to the registry. It doesn't go unless it comes from my current provider, who can send unless I opt out, or from a prior provider at my specific request, which is the opt-in. So I don't have to go back 60 years and figure out who I've got to contact if there's
They
still...
can
Rep.
send it
Sherman.
in
And
without
actually, there was
determination.
an interesting point. This is the other reason to pull out the non-discriminatory language. I looked at the penalty phase of this
That's
statute,
knocked out.
and you all can correct me if I'm wrong, but if a provider puts you in the registry, either a past provider puts you in the registry without you requesting it, that's a misdemeanor. Am I correct? Based on statute.
Yeah, wait, one person was nodding her head. Is that true or not?
When I wrote this, amendment, Sharon Ayers and I went back and looked at the penalty for non-compliance. And it's actually a criminal offense to do what you're saying would happen. And
So what Ms. Condon is referring to does not happen because of that
Well,
penalty?
not unless you want to go to jail.
No, this one, or a license, revocation, or,
License,
okay. Madam Mayor.
Representative McGann, in addition to that, this bill has a specific provision, page 1, line
Are
27.
you reading from
It's
Sherman's amendment, or?
It's on both. It's
Okay.
be in Sherman's amendment and in Representative Kirk's. Page 1, line 27.
Okay.
Except as provided in paragraph 2 above, no information relating to an immunization vaccine shall be reported by a healthcare provider or any other person. So there's an underline in the bill as to that requirement.
And that is agreement to the subcommittee. We understand that is protected unless the patient allows it to be disseminated by permission.
or asks it.
Or asks it, but put this all together. One more time, Ms. Condon.
Just if I can make my final points
please.
here. And to follow up, there's nothing that provides me with protection of not being in this registry, because nothing requires my signature to be out of it.
Oh, wait, let's hold that. Can we speak to what Ms. Condon just said? Is that true?
Could she repeat it? I
Could you
didn't
repeat the
understand.
question?
Specifically, so we all understand again.
There is no requirement for a doctor to have my signature to put me into the registry. The requirement is to have my signature to keep me out of the registry.
Okay.
So that if I'm accidentally put into the registry, there's nothing on file that I signed that says, no, I didn't want to be a part of this. And that protection is not provided.
And your response to that?
Representative McMahon, on page 1, line 16, when a patient exercises the option not to be included, they will check off a box and sign and date a document. And that is how the documentation of their opting out is recorded.
But
Okay, Rep. Kirk?
And if I wasn't contacted, didn't have an opportunity to sign that, that doesn't
her
exist.
concern is that the doctor screws up and puts the information in because she wasn't given an opportunity to opt out, and there's no record, which is the case, of a person's decision not to opt out. Okay? So her concern is some doctor is going to improperly put her information in there. But I point out to her that he's violating the law because it says that he has to give you that opportunity. If he doesn't, his argument is going to be, I gave it to her and there's no record of it, and she's going to say, wait a second, you never gave me the opportunity. He says, she says. That's her fear.
And in addition, if I may, on page 2, line 12, it says that the patient may withdraw from participation at any time. So when you find out that your information has been put in, you then may withdraw from participation and remove information by submitting a request and requirement to the department, at which time the department has to expunge everything, including the opt-out. And we're back to square one. Is that right?
But that would put a burden on me to contact a vaccine provider because I do not have access to, I cannot contact the state directly and say I'm in the system. I have to contact a vaccine provider and say, will you check on my behalf to see if I'm in the registry?
Fothergill?
I would just say that, you know, as a physician, I am not perfect and I make mistakes. Sure. But there are much bigger mistakes that people should be worried about me making than just some missing the sign, because that's the mistake I'm not going to make. It's not, you know, I just think we're getting way beyond what we need to do.
Yeah, we are.
Yeah, we are.
I was just going to say, this is a compromise.
Yes.
And just as you are unhappy with it, everybody has things in it that they don't like. That's what a compromise is. And I think we're getting well into the law of diminishing returns here, and I would very much like to proceed to.
Understand. We'll have one last comment
A very quick comment,
from Dr.
and I concur with representatives, because when we know the number of kids in New Hampshire that are vaccinated, for instance, we use the measles mumps rubella vaccine, we know that roughly 96% of the kids are vaccinated. It's a whole lot more difficult and cumbersome to make sure all of those are actively logged, rather than removing the few folks, because we've got a lot of other stuff going on in practice. We're going to be diligent. We are in the business of securely handling confidential information. Nobody's going to transmit anything unknowingly or unlawfully.
Okay, as one more.
I'd like to make a motion ought to pass as amended.
I'll second it.
May I make a factual correction?
No, there's a motion on the table.
No, we have.
You need to move the amendment.
I move the amendment.
You want to move the amendment?
0728, I'm sorry, 0724H, the amendment to 380.
Okay.
That's me. I swiped Representative Kirk's.
0724H, which everyone had a copy of. And, okay. And we had a motion by Representative Sherman. Do we have a second by Representative Emerson? Is there any further discussion on this motion? Fothergill? On the motion?
My vote? Yes.
No, I'm asking if you had anything further before we take a vote.
No, I'm all set.
Okay.
All set.
All set. Okay, we'll have
Call the roll.
We'll have the vote. Representative Weber.
Aye.
Yes.
Representative Sherman.
Aye.
Representative Fothergill. Yes. Representative Emerson.
Yes. And McMahon,
Yes.
5-0.
And that's on the amendment. So,
Yes.
Now, as far as the bill as amended, we'll have the same, a motion once again on behalf of the subcommittee.
I move ought to pass as amended.
And I'll second.
Representative Weber.
Aye.
Sherman. Fothergill. Emerson.
Yes.
So,
5-0.
recommendation to the full committee, which will be meeting in a moment, is ought to pass per the Rep. Sherman Amendment 0724.
That's correct.
That's it.
And I
Okay,
would just like to
thank you,
add my
folks.
thanks to everybody else's for all the people who have labored on this.
Absolutely.
If I could say on
Just make sure your
paragraph
doctor
2,
knows you want out.
I'm looking at it a week from today. If that's okay, you want to be part of that? Or? You want to be part of that?
If you want to get it done while we're young, that may be the case. The issue, okay, we'll call the meeting. Thank you, Ms. Connors, for being here. We got some answers for you right from the bill. And we will call this subcommittee to an end.
I'll
Thank
give
you
you,
very much.
I used your pages.
I listened enough so I know how to vote.
If we don't have anything, I do something.
I'm glad that you did, because I was going to approach you and bring so let's just get it out as soon as possible. And
If you want to be a part of the paragraph 2 discussion, can you shoot me your email address? You bet.
I've met you before, so I know I see you all the time. Yeah, so it's just I know I've met you before.
Yes. I like the Chiefs of Army, so we follow all the NH vaccines. And I have funeral too. So there's a lot of overlap Oh shoot, he just gathered. I can send it to you, but I couldn't have it. Oh, okay. Thank you.
Yeah, and I sent them another email.
And what just was exactly what was agreed to represented.
I don't think.
Was what we have that kind of respect.
You mean the way it's written in the amendment?
Do
you guys want 628, the amendment?
Everyone goes
Yeah.
I don't know.
Only a few more. You guys can duke it out.
This we don't have to. This is another question. No, I'm gonna give that back to you. We're very happy with
Oh, I need this one anyway.
We expect the bill that we just heard, based on the recommendations from the subcommittee. We're going to present House Bill 383 relative to the vaccination register. Senator McCann will report to us the working subcommittee.
Okay, thank you, Mr. Chairman. First, I'd like to offer that the work that was witnessed by most of our members right now was most of it was not witnessed because it took place with Rep. Kirk, Rep. Sherman, a meeting with the department, and Attorney Williams and the team, along with Ms. Monahan, as stated earlier. So they did the yeoman work, and with Dr. Lamb and et cetera, and also the contribution of Ms. Condon too was an influence on how to develop this and to meet the intent and the goals to ensure a higher health result for our citizens in New Hampshire. So that being said, a consensus, I believe, has been achieved, and we had a 5-0 recommendation to approve and ask for the full committee's approval for the House Bill 383 as amended, with the Representative Sherman's amendment as discussed for us to pass. And we believe it's the right thing to do and to do it today.
We having heard that, are there comments from the committee?
Oh, I'd like to comment something.
Please do, Representative Cummings.
I feel that this opting in, opting out is so important to people. They ought to make sure that whoever their healthcare provider is, they go to them and say, I want to be opted out of this. And then there would be no question if, did the doctor opt me in or what? If they go and they're just real specific, I want out.
Thank you, Representative Emerson. Any other comments? Representative Heiser.
I'd be happy to speak, but I believe Representative McKay had his hand up first.
Representative McKay will defer.
Thank you. I feel strongly that we need an opt-in instead of an opt-out. And I believe that most of my constituents from across the whole range of ideologies would agree with that. And I don't usually like to make decisions based on worst case scenarios or what things might lead to, but I worry that this bill leads us towards things that we don't want to get into.
Thank you, Representative. Representative McKay.
There were several questions that arose around this legislation, broader issues, as well as the registry itself. My plan would be that when the oversight committee meets, that we put this on our agenda, that we start looking at the department to come to us on a quarterly basis and report on the workings of the registry, as well as some of the questions that Representative Emerson and others brought. I think that will, I wouldn't say that I would doubt that the Senate would do deep research, but my own experience in the past has been that they tend to be very speedy. And so I think we should be prepared as a House and Senate Oversight Committee to do that.
Thank you very much. Representative Sherman.
I would like to respond to Representative Heiser's concerns. When you look at what drives people, I think I'm going to be blunt and probably not very political. When you look at what drives people in their fears and concerns, the two big concerns, number one is any kind of database. And the ability to not be in the database is very important, and that's in this compromise. What drives the need for a registry is the risk of children dying unnecessarily. The Florida outbreak, one of the reasons that they were able to act as swiftly as they could is Florida has an opt-out registry. That means they have almost unanimous participation, and people still have a right to opt out. So, when we look at public health, when we look at medicine in general, the single biggest life-saving aspects of medicine, if you look through the history of medicine, all have to do with public health. Whether it's development of the sewer system, that's what got rid of the bubonic plague. When you look at the development of other public health measures in response, vaccine rate as probably one of the most important, if not the most important, life-saving. With all respect to those who are concerned, some people have an adverse reaction to vaccines. But to drive public policy based on unsubstantiated fear is not, I believe, the important task that we have at hand. To protect the individual as we pass public policy is what we have done with this amendment. not only can they opt out, but the department has a way of making it so that they were never in the registry in the first place. They can expunge every single piece of data that that person had in the registry, including their request not to be in the registry. And I don't think there's any better protection either for the individual or for all of us, and especially our children, than this amendment. And that's why I feel very strongly that to do an opt-out, the bottom line of doing a global opt-in, is that the registry will not be functional. That is shown in every opt-in process that there is. So the goal is to say, how do you get a functional, efficient registry while protecting the individual? And that's what, there is no stronger privacy advocate than Representative Kirk. And he's comfortable with this. And I think it is fully defensible across my constituency. And I'm happy to sit down with anyone on your constituency one-on-one and explain the medical concerns and the public health concerns. But I would ask you not to be driven by the concerns of a few individuals at the expense of children who cannot be given protection.
Thank you, Representative Sherman. Anyone else have comments?
Thank you. Yeah, I do.
Representative French.
Thank you. I have to say, for me, as a healthcare professional, and always looking at the common good, the one most important thing was that we were going to have to opt out, not opt in. I just think for the common good, too important to allow people to just opt in, and I just don't think that's adequate. And I understand your concern, but for me, as a healthcare professional, one thing I was going to hang out for, I was hoping you were going to bring it in. We have to opt out.
Thank you, Representative. Representative Tyser.
Thank you, Representative McKinney, and to the members of my committee. I'm struggling very hard not to take this personally, but I would like to say that I think that the committee is being very short-sighted and not looking at the broader picture of the effect that mass immunizations are having on our public health in terms of autoimmune diseases, as well as the reactions and the risks to people. And I also don't believe right now, and I wish I did, that the government records were the best way to address an epidemic, particularly in the age of social media and the internet and all that we have at hand.
Thank you, Representative Tyser. Representative Sherman.
I hope there is absolutely nothing personal about this. But there is also virtually zero medical evidence that autoimmune disease is the result of vaccines. There is no evidence that the vaccines cause autism, and in fact, the physician in England who brought that up in Lancet has been so discredited that he has lost his license and every ability to practice medicine. It was bad data, it was bad reporting. So let's stick with the science and allay the fear with the science. And that's what I'm asking people to do. But again, this is not about whether vaccines are good or bad. This is about the risk.
Thank you, Representative Sherman. I appreciate that. I think we need to stick with what we're really dealing with, that is whether or not we want to see a registry established in New Hampshire. I think we talked about the reasons. All of us, any of us can have our personal reasons for voting against this, and I would urge you to do so if you're so inclined. I respect all people, everyone in here's beliefs on this issue, so I think we've heard an awful lot. Representative Emerson?
I just want to say one thing. I remember back in the 50s when there was a polio outbreak, and children, adults, my aunt in particular, came down with polio. And it was not up to any of us. The federal government stepped in and said, everyone will be vaccinated. And I can remember the polio shots, and then they went to polio medicine on sugar cubes. So I think this registry is far better than the US government stepping in and saying, this is a nationwide epidemic and this is what's gonna happen.
Thank you, Representative. I think we've probably discussed this enough unless there's more discussion to repeat the same thing we've been hearing. I will ask, the motion is, as presented to us by the subcommittee and for the discussion. The motion is ought to pass with amendment number 2015-07248. And we will be amendment first. We will vote the amendment first. I'll ask the clerk to call.
Well, then make the motion.
I've heard the motion already. I'm going to ask if the same folks that made the motion to the subcommittee
Oh, sure.
have made this motion.
Okay.
I want to make sure that
Charlie will
okay, we're voting on the amendment. Clerk, please call the roll.
Representative LeBrun.
Yes.
Representative Emerson.
Yes.
Representative McMahon.
Yes.
Representative Nelson, yes. Representative Schmidt.
Yes.
Representative Guthrie.
Yes.
Representative Ward.
Representative Ward is excused.
Representative Donovan.
Yes.
Representative Fothergill.
Yes.
Representative McKay.
Yes.
Representative French.
Yes.
Representative Deloge.
Representative Deloge is excused.
Representative Sherman.
Yes.
Representative Ticehurst.
Yes.
Representative Weber.
Yes.
Representative Freitas.
Yes.
Representative Gordon.
Yes.
Representative Snow.
Yes.
Representative Katowski.
Yes.
Unanimous?
Unanimous. What's that? Oh, that's the amendment. That's the amendment. Now we have to vote on the bill as amended. Any discussion on the bill as amended? Hearing none, I'll ask the clerk to call the roll.
I move to pass the bill.
Okay. Representative Sherman. Second. Representative Fothergill. Thank you. Now I will ask the clerk to call the roll.
It is to, as amended.
Ought to pass as amended.
Representative LeBrun.
Yes.
Representative Emerson.
Yes.
Representative McMahon.
Yes.
Representative Nelson, yes. Representative Schmidt.
Yes.
Representative Guthrie.
Yes.
Representative Donovan.
Yes.
Representative Fothergill.
Yes.
Representative McKay.
Yes.
Representative French.
Yes.
Representative Sherman.
Yes.
Representative Ticehurst.
No.
Representative Weber.
Yes.
Representative Freitas.
Yes.
Representative Gordon.
Yes.
Representative Snow.
Yes.
Representative Katowski.
Yes.
16.
Consent? So moved by Representative LeBrun. Without exception? Consent is. I would remind.
No, I meant, no, I don't have any
Okay,
objections.
Do you have any objection to that?
I have no objections.
You are perfectly welcome to write a minority word, and we'll put it on the regular calendar.
No, thank you. I think I began to make my views clear, but have a lot of work to do.
Whatever. Thank you very much. One thing we do expect will happen is Representative Sherman, Representative McMahon will usher this thing for us through the Senate with the proper wording, working with the department and others together.
I would like to apologize to Ticehurst if she felt shut down or attacked. That was not my goal. I did have an extra cup of coffee this morning.
She knows that.
But I love her dearly and
I just, you know,
Representative Fothergill.
Thank you.
I would like to say,
seems like so much work.
and I don't think there was a
fall on deaf ears.
We went through this with him.
And I think there's lots of things that will
Years ago, I
go
remember
But in
doing
fact,
this was
the
here.
registry will be a data bank that will now allow us to prove some of those points, or to disprove them. Because now it's just sort of willy-nilly, but if you can actually, if you have the data banks, and we have them, as we go over the course of years, we have a better chance of demonstrating that a vaccine may be associated with something down the line, or not. So I think that having a data bank like that is going to help us, clear things up as opposed to still be.
And just to add to that, I was thrilled to hear that they're going to have lots on there. So not only will there be the ability to track reactions and outcomes, but there will also be the ability to track safety.
With that, Representative.
First, I want to say I have a great deal of respect for Representative Clay because she will always say what she should
I think the boys internal, so it's adults.
I doubt that this is going to stay 100%. I'd be very surprised. So I'm not going to say take it off.
I don't know, see if they did this with the NBA one. This supposed to be, do we do that already? Is that for the certificate? Yeah.
Yesterday was proof positive to me that the work of this committee has done very, very well. So well, in fact, that a couple of the bills that were pulled off of the consent calendar didn't even know about it for discussion. And that's because I think good people in here stood up and made their case on the bills that we did have to debate. And after that happened, I think folks out there realized that we had to work together. So thank you for the way you did it. Representative Smith.
Not related to the bill, I just want to apologize to the committee, people who were here who might not be here for that subcommittee meeting. Just as I was walking out the door, I had a call from a constituent. I used to work at the mental health center, even though I'm retired. That firm was fixed really high. And I really felt that it was inappropriate for me not to respond to the wish, and I apologize for that.
Thank all of you for coming. We have one more bill to exec, and we're done with the health bill. We will begin to receive Senate bills after that. We will meet our noon time today deadline. I think. Okay. The last bill we're going to exec is House Bill circumstances, and we were to have in our hands an amendment which hopefully will make this bill ready to move on. Representative Sherman has provided that.